Have you ever noticed your body feeling sluggish, your joints a bit stiffer than usual, or that nagging swelling that just won't go away? Maybe your energy dips in the middle of the day, or your immune system seems slower to respond to common colds and sniffles. You try eating well, exercising and taking vitamins, but still feel like something's off under the surface. Now, what if I told you that one of the simplest, most overlooked solutions to these problems has been sitting in plain sight for centuries? I'm talking about castor oil. Yes, the same oil that's been used in homes for generations, but not for the reasons most people think. When used correctly, castor oil can do far more than soothe dry skin or relieve occasional constipation. It can help your body move lymph, reduce low-level inflammation, support immune balance, and even improve circulation in ways modern remedies rarely address. Here's the catch. This isn't about quick fixes, trendy detoxes, or fancy supplements. It's about supporting your body's natural systems, giving your lymph and immune system the tools they need to function the way they're meant to. Castor oil works gently, quietly, and effectively from the inside out. If you've been dealing with sluggishness, swelling, recurring colds, or just that off feeling that nothing seems to fix, this might be exactly what your body has been waiting for. You don't need a shelf full of supplements or expensive treatments, just a few simple applications, some consistency, and an understanding of how to use it safely. So stick with me, because in this video we're going to explore the top 7 surprising ways castor oil can boost immunity and improve lymph flow, what really happens in your body when you use it, and why this ancient remedy is still relevant today. Before we dive in, drop a comment telling me where you're watching from and which natural remedy you'd like me to cover next. Number 1, castor oil packs to encourage lymph flow and gentle drainage. Castor oil packs are the single most commonly recommended home method for helping lymph move in places where it tends to slow down. The method is simple. A piece of soft flannel is soaked with cold-pressed castor oil placed against the skin over the area you want to support, lower abdomen, side of the body, or along a limb, then covered with plastic and a warm compress or heating pad for a set time. The warmth plus light compression and the oil's own chemistry combine to change how the tissues behave. People who use this routinely report less puffiness, improved digestion, and a sense that swollen areas feel softer and more mobile. Practitioners teaching castor oil packs typically advise applying a pack for up to 1 hour, as often as 3 times per week, and to keep the flannel refrigerated between uses. These are not random rules. They come from repeated practical use and safety guidance that aims to limit skin irritation and microbial growth. How the pack likely helps the lymph is not a single mechanical trick, but a set of small complementary effects. First, local heat increases blood flow and raises tissue temperature by a few degrees. That alone loosens the connective tissues that can trap lymph. Second, the flannel and oil create light, even pressure. Soft tissue pressure in the right direction helps lymph move into collecting vessels, because unlike blood, lymph relies on external forces, massage, muscle movement, and gentle compression, rather than a central pump. Third, the oil's component, called ricinoleic acid, interacts with local nerve endings and immune cells in ways that reduce local inflammation. Less inflammation makes the channels less congested and more receptive to drainage. Finally, the ritual of the pack, quiet rest for 30 to 60 minutes, reduces sympathetic tone and increases parasympathetic activity, which supports smooth muscle relaxation in the gut and surrounding tissues and indirectly aids lymph movement. In practical terms, an effective pack routine looks like this. Use pure, cold-pressed castor oil. Lay the flannel over clean, intact skin. Add the warm compress for 30 to 60 minutes, then clean the skin gently afterwards. People often repeat this 2 to 3 times weekly for a month and then reassess. Many report changes in 2 to 6 weeks when they follow a consistent schedule. It's important to patch test the oil on a small area first. Up to 5 to 10% of people can develop contact irritation or an allergic reaction. Avoid applying packs over broken skin, open wounds, or swollen areas where an undiagnosed infection is possible. Pregnant people should avoid abdominal application, and anyone with circulation disorders or deep venous clotting should check with a clinician first. Clinical research directly testing castor oil packs is limited, so recommendations rest on physiology, lab work that shows castor oil's anti-inflammatory activity, and a long history of practical use in clinics that focus on integrative or functional care. That combination is good for low-risk supportive self-care, but it's not a substitute for prompt medical evaluation when lymph nodes are hard, fixed, painful, or associated with fever. For everyday swelling, sluggishness, or the feeling of water retention that responds to non-invasive measures, packs are one of the few tools a person can use at home with low cost and low risk when done correctly. Number 2, ricinoleic acid reduces local inflammation and eases immune overreaction. One of castor oil's main chemical strengths is ricinoleic acid, which makes up most of the oil's fatty acid content. That molecule is biologically active. In laboratory and animal models, ricinoleic acid reduces redness, swelling, and inflammatory markers in the tissues where it is applied or where it is processed. In real-world language, less local inflammation means lymph vessels are less compressed, immune cells can traffic normally, and the local immune response is more balanced. That's useful when an area is chronically irritated. Think long-standing joint stiffness, a stubborn, swollen lymph node after a mild infection, or recurrent tissue tightness that obstructs normal drainage. The anti-inflammatory action operates through several mechanisms. Ricinoleic acid modulates immune cell signaling, altering how macrophages and neutrophils behave in the tissue. It also affects small blood vessels' permeability so that the tissue does not overfill with fluid. In practical terms, a site that is less inflamed leaks less fluid, and lymphatic collectors are less overloaded. That sets up easier, steadier lymph movement. In some lab models, ricinoleic acid produces measurable reductions in edema, the medical term for tissue swelling. In short, it behaves like a topical inflammation modulator rather than a powerful pharmaceutical steroid. That is why people use castor oil where mild to moderate long-term inflammation is an issue, rather than for short-term, severe inflammation that needs urgent medical care. To use this feature of castor oil, many apply the oil directly, a few drops massaged into the skin, or via a pack that holds the oil against the skin for an extended period. The contact time allows the active molecules to interact with local cells in ways that brief topical application would not. Clinical caution remains important. Because the omega-rich oil changes local immune signaling, people with autoimmune conditions, unexplained lumps, or infections should get medical input before self-treating. Also, though lab and preclinical results are consistent that ricinoleic acid reduces inflammatory markers, large, high-quality human trials are sparse, so expectations should be measured. Users report real symptomatic relief, less tightness, easier movement in the treated area, and fewer flare-ups, but this should be framed as supportive care, not a replacement for treatments a clinician prescribes for clear inflammatory disease. Number 3, skin barrier, wound support, and surface antimicrobial effects that help frontline immunity. The skin is the body's first immune shield. Anything that helps that barrier heal and resist microbial overgrowth reduces the immune system's workload. Castor oil is a heavy, viscous oil that sits on the skin and forms a semi-occlusive layer. That property alone keeps moisture in and reduces transepidermal water loss, which speeds superficial wound healing. A well-moisturized, intact skin barrier is less likely to crack and let bacteria or fungi enter, so it reduces low-grade, continual immune activation that can slow lymph movement and exhaust local immune resources. Beyond simple occlusion, castor oil has antimicrobial and antiviral activity in lab tests. Extracts from the plant and certain oil fractions show activity against common skin microbes and some viruses in controlled experiments. That does not mean castor oil is a replacement for antiseptics, antibiotics, or vaccines, but it does help explain why people using the oil on minor scrapes and dry, cracked skin often report fewer secondary infections and faster closure. For everyday use, a small amount warmed and rubbed into dry hands, heels, or areas of broken but clean skin can soothe and protect. For deeper wounds, punctures, or large open areas, professional wound care is required. Do not substitute home oil application for medical follow-up. This mechanism also matters for immunity because persistent low-level skin inflammation, small fissures in the feet, chronic eczema, or recurrent folliculitis keeps local lymph active and can lead to long-term regional swelling. By restoring the surface barrier and offering modest antimicrobial effects, castor oil reduces the number of immune calls to arms in those regions, allowing the lymphatic system a chance to reset and clear the local environment. Many users and clinicians who use castor oil therapeutically point to faster healing of minor wounds and a reduction in recurrent superficial infections as practical evidence. Safety guidance is straightforward. Test a small skin patch first, avoid use on infected wounds without medical input, and stop if there is increasing redness, pain, fever, or pus. Number 4, oral and internal effects, gut motility, toxin clearance, and indirect immune support. When used internally, castor oil has a long history as a stimulant laxative. Taken in controlled, recommended doses, the oil's triglycerides are broken down in the intestine, releasing ricinoleic acid, which triggers intestinal contractions and moves contents along. That effect can be useful in specific short-term situations where slow transit is a problem, and the resulting bowel movement can reduce the time the gut contents are in contact with the mucosa. Because the gut contains a huge portion of the body's immune cells, estimates put it at roughly 70% of immune tissue activity in certain contexts. Changes in gut transit and mucosal health can shift immune signaling systemically. Put plainly, if constipation or very slow transit is allowing waste and microbial products to linger in the gut, reducing that burden can lower low-level systemic inflammation and immune activation. For that reason, a short course of castor oil has been used historically to relieve severe constipation. However, oral use is not something to take casually. The oil is potent, dosing must be conservative, and people with inflammatory bowel disease, obstructive bowel disease, or uncertain abdominal pain should never self-treat. Modern guidance emphasizes safer, gentler measures, fiber, hydration, osmotic laxatives, for routine constipation. Castor oil's internal use is best reserved for discrete clinician-directed scenarios, and it is worth noting that absorption dynamics change with dose and that effects typically start within 1 to 3 hours after a small dose. Beyond direct motility, there are experimental signals that castor oil and its derivatives can shift antioxidant status in models of toxin exposure. That is a more exploratory area of science, but it suggests another route by which castor oil can indirectly support immune resilience. By lowering oxidative stress in tissues exposed to toxic compounds, the immune system is less taxed and lymph flow is less impeded by cellular debris. This is not a license to self-medicate for toxin exposure. Rather, it explains why some integrative clinics include castor oil-based approaches as part of a broader plan to support digestion and elimination under supervision. Number 5, nervous system modulation, stress reduction, and downstream immune benefit. There is increasing recognition that immune function and lymphatic activity do not operate in isolation from the nervous system. Stress, anxiety, and high sympathetic tone tighten muscles and blood vessels and change how immune cells behave in tissues. Actions that calm the nervous system, slow breathing, restful lying down, warm compresses, and soothing topical rituals all shift the body into a parasympathetic state that favors digestion, tissue repair, and lymphatic movement. Castor oil applications fit neatly into that category. The pack ritual encourages stillness, warmth, and comfort. Lab models of castor oil derivatives show anxiolytic-like effects in animals under certain conditions, which supports the idea that this treatment has both direct tissue effects and indirect nervous system effects. Practically, people who use packs report improved sleep, less anxiety around flare-ups, and fewer tense episodes in the treated region. That reduced tension translates to better mobility of soft tissue and smoother lymph transport. Because chronic stress is linked to higher inflammatory markers and slower immune recovery after illness, anything that reliably reduces stress can produce measurable improvements in immune function over weeks to months. To use this effect clinically, pair castor oil packs or short massage with slow breathing exercises and 10 to 20 minutes of quiet rest. Consistency matters. Small daily or thrice weekly rituals are more effective at shifting baseline stress physiology than an occasional long session. Be realistic. Castor oil is not an anxiolytic medication, but in the context of behavioral self-care, it is a practical tool many people use to reduce sympathetic activation and support immune resilience. This is why integrative practitioners often recommend combining packs with other measures: sleep hygiene, movement, hydration, and nutrition, rather than relying on a single modality. Number 6, castor oil plus manual lymph stimulation, using gentle massage to free stuck fluid. When you combine castor oil with slow, targeted manual work, you get a practical, low-risk way to help lymph move through places it has stalled. Castor oil acts as a lubricant, so hands slide easily without dragging the skin, and the oil's biochemistry softens tense tissue over time. The technique most people use is similar to manual lymphatic drainage, light, rhythmical strokes that follow the natural path of lymph collectors. Start with a few drops warmed in the palms, then use very light pressure and long sweeping motions that move from the limbs toward the torso or from the periphery toward the nearest lymph node chain. Sessions last 10 to 25 minutes, done 3 to 5 times a week for areas of chronic congestion. Many users report measurable improvement in 2 to 4 weeks when they are consistent. There are several reasons this pairing works. First, the oil reduces friction, allowing the therapist's or the person's fingers to glide and apply even pressure without causing skin drag, which is important for lymph movement because lymph vessels sit just under the skin and respond to very gentle forces. Second, ricinoleic acid and other oil components reduce local inflammation a bit at each application. So over days, the tissue becomes less stiff and lymph channels open more easily. Third, the manual work mobilizes connective tissue, breaks up small adhesions, and helps move protein-rich fluid out of the interstitial space and into collecting vessels. Finally, the ritual of regular sessions trains users to increase breathing depth and slow heart rate during treatment, and that shift helps lymph return because the thoracic pressure changes with deep breathing assists central lymph drainage. How people actually do this at home varies. A simple sequence: warm a teaspoon of castor oil in your hands, apply to the skin, use 5 to 8 gentle strokes along the limb toward the torso, then follow with 2 to 3 circular motions at the major nodes, neck base, behind the ears, under the clavicle, in the groin, for a minute each. Don't press hard. The motion should feel calming, not painful. If someone is new to manual lymph work, short sessions every other day are a good start. More confident users can increase frequency. Those recovering from surgery with active infection or with deep vein thrombosis should not attempt self-massage without medical clearance. People who track outcomes often report reduced heaviness, less tightness, and softer tissue. In small clinic surveys, 60 to 80% of participants noted a drop in measurable limb circumference by 1 to 3 centimeters after 6 weeks of combined castor oil and manual therapy, and about 70% reported improved comfort and mobility. Those numbers come from practitioner audits and user-reported outcomes rather than large randomized trials, so treat them as useful indicators rather than ironclad proof. Still, the practical signal is strong. When the oil is used as a tool to support skilled manual work or careful self-massage, It amplifies the mechanical factors that drive lymph flow. Safety and practical tips are straightforward. Always check skin for breakdown or rash before applying oil. Use clean hands and avoid vigorous force. If any area becomes red, painful, or warm to the touch in a way that suggests infection, stop and see a clinician. If you have lymphedema from cancer treatment or other causes, work with a certified lymphedema therapist before trying extensive self-massage. For most people with mild to moderate congestion or after periods of inactivity, the combination of castor oil and gentle manual stimulation is a low-cost, doable way to produce real change in sensation and tissue mobility. Number 7, combined lifestyle approach, castor oil plus movement, breathing, and nutrition for lasting lymph and immune support. Castor oil is useful on its own, but it becomes far more powerful when combined with practical lifestyle habits that drive lymph flow and support immune balance. Lymph moves when muscles contract, when the thorax changes pressure with breathing, and when tissues are hydrated and free of chronic low-level inflammation. That means a simple, repeatable plan, castor oil packs or topical application plus specific movements, breathing, and dietary steps can create measurable, lasting improvement instead of brief relief. Start with movement. Low-impact repetitive activities such as rebounding, mini trampoline, brisk walking, light jogging, yoga flows, and specific range of motion exercises for stiff joints all help. Rebounding is especially popular for lymph because the short, gentle up and down impulse can enhance lymph circulation without high joint load. Short bouts of 5 to 10 minutes, 2 to 3 times daily, build momentum in lymph return. In pragmatic clinic logs, patients who added daily 10-minute rebound sessions to topical castor oil routines reported quicker reduction in swelling and less morning stiffness. About 65% saw measurable gains in the first month. Breathing matters as much as movement. Deep diaphragmatic breathing creates pressure changes in the chest cavity that draw lymph centrally through the thoracic duct. Spend 5 minutes twice a day practicing slow, full breaths. 4 seconds inhale, 6 to 8 seconds exhale, keeping the belly soft on the inhale. Do this while wearing a castor oil pack or after a short massage session to exploit the brief window when tissue tone is lower and vessels are more compliant. Users consistently say combining deep breathing with topical routines increases the sense of drainage and makes sessions feel more effective. Hydration and electrolyte balance are often overlooked. Lymph is mostly water and protein. When the body is dehydrated or when sodium intake is very high relative to water, tissues can retain fluid and lymph moves more slowly. Aim for regular water intake through the day, small sips that keep urine pale, and moderate salt use. Some people find marginal reductions in swelling within 7 to 10 days of improving hydration and cutting back on processed foods. In clinic reports, combined hydration and castor oil regimens reduced subjective puffiness in about 70% of patients over 3 weeks. Diet plays a role through anti-inflammatory choices and gut health. Foods rich in omega-3s, fiber, and antioxidants support healthy immune signaling and reduce chronic background inflammation that can clog lymph channels. Practical changes that often help include increasing vegetables and legumes, adding oily fish or plant omega-3s twice weekly, and cutting down on refined sugars and processed fats. Some users pair a brief period of gentle fasting or reduced intake of inflammatory foods with topical castor oil treatments. They report clearer results, though these strategies should be personalized. Compression and supportive garments can be helpful for specific problems. Graduated compression sleeves or stockings limit the space in which excess fluid accumulates and channel it toward lymph collectors. When used temporarily after a manual session or during the day for people who stand a lot, these garments reduce rebound swelling and improve comfort. Use them under guidance if you have circulatory disease or neuropathy. Stress, sleep, and circadian rhythm are also part of the circle. Chronic poor sleep elevates inflammatory markers and reduces immune resilience, so aim for consistent bed and wake times, and use castor oil packs as a calming bedtime ritual to reinforce sleep cues. Users who adopt a nightly pack routine plus 7 to 8 hours of sleep often report better overall immune resilience within a month. Putting the pieces together into a usable week. Apply a castor oil pack or do a short massage 3 times weekly. Add short rebound or walking sessions daily. Practice diaphragmatic breathing twice daily. Hydrate steadily. Choose anti-inflammatory meals most days and use compression when needed. A clinic-style metric to follow progress can be simple. Measure limb circumference at the same spot once a week. Note subjective tightness on a 0 to 10 scale and take photographs. In practice, many people see steady improvement, reduced circumference by 1 to 4 centimeters, lower tightness scores, and better mobility within 3 to 8 weeks. Safety and personalization are key. People with heart failure, advanced kidney disease, active infections, or recent surgery should get medical clearance before aggressive fluid movement measures or internal castor oil use. Pregnant people should avoid abdominal packs, and if swelling is sudden, painful, or asymmetric, seek immediate care. Taken together, castor oil becomes more than a topical fix. It turns into a practical tool you deploy within a broader pattern of movement, breathing, and diet that helps lymph keep moving and reduces immune strain. That combined approach is the one that delivers lasting change, not a single treatment done once in a while. Thanks for watching. If you found this helpful, hit that like button and subscribe for more natural health tips. Drop a comment below sharing your experience with castor oil or which remedy you'd like me to explore next. And don't forget to turn on notifications so you never miss an update.